Good morning, everyone. We have several guests to welcome this morning. First is Dale Sanders, who is right here on the end. Dale is the father of an overdose victim. He lost his son about 7 years ago. Pastor Seibert Taylor, who many of you know with Ministers of Christ Kingdom. John Moses is our team leader in harm reduction services at the Lexington-Fayette County Health Department, and our city's substance use disorder intervention program coordinator, Amy Baker. You have the longest title, maybe. In the midst of this COVID pandemic, my dedication to finding a local solution for people caught in the web of another epidemic, opioids and now polysubstance abuse, has not wavered. Like many other cities, Lexington has seen an increase in overdoses in the past few months. Fayette County recorded 128 overdose fatalities in 2019. As of August 17th this year, we had already experienced 130 overdose deaths. The increase comes after a 2-year decrease. The number of overdose fatalities in Lexington peaked at 187 in 2017. Then we experienced a decrease in 2018 with 161 fatalities, and again in 2019 with 128 fatalities. In isolation, drug usage increases. That has always been the case, but it has been made clearer now. And increased usage means increased overdoses. So especially in a pandemic, we have to continue to do what we can to make sure everyone has access to the tools they need for recovery. Today is National Overdose Awareness Day. Dale Sanders, who lost his son to an overdose, is here today to speak about why this work is so important. Dale, welcome to the podium.
Thank you, Mayor, and thank you so much for the opportunity to be here today. We're very grateful for that. Thank you, Amy, for all your team and your work, and all the first responders who help so much to fight this battle of this epidemic of drug overdose. I'm very grateful for naloxone as well, because it does save lives. Every life is precious. It's a precious gift from God, and I'm so grateful for that. On April the 15th, 2013, at 8:15 a.m., a phone call came. Your son, Heath Thomas Sanders, is dead. My wife, Anna, lost her son. Our granddaughter, Avery, who was 6 years old at the time, lost her dad. Heath was a good man with problems that controlled his life. He worked hard. He had a good ethic of work, and he loved people. He especially loved his daughter, Avery. But this disease took everything. When Heath died at age 32, everything that he owned could be carried in 2 backpacks. It took all that he had. I want to just share this morning just a couple of things that we've learned in the past 7+ years. First of all, this can happen to anyone. As the mayor mentioned, this epidemic has caused a great increase in the need for help, and stress has gone rampant. It can happen to anyone of any race, religion, or anyone of any economic status, believe me. The second thing that I've learned is that we need to get help. For the family of the addict, it's devastating. I wish I had time to tell you all the stories. The one thing that I would share that We knew that Heath was safe whenever we could be with him and see him, and he was under control, but it was devastating. The next thing that I wanted to share with you is I had to learn to forget my pride. I had to think, not my son, not my family, but it did. And I had to step aside and ask for help. In 2013, there were not nearly the resources available that there are today. The next thing I wanted to share is that I had to ask God for strength and wisdom. Those were two very important things. Let me just finish with this. To the addict, if you're watching or hearing, and you may not be, but I hope that you are, reach out. Get the help that you need. Don't be too shy or ashamed. Reach out. To the family of the addict, don't give up. No matter how many times it takes, keep trying as long as you can. To those who have lost loved ones, we are here for you. We want to hear your story. Your sons, your daughters, your mothers, your dads, they all had a life that was very important. And I close with this. About 5 years ago, I traveled to Myanmar, and halfway around the world, we were getting ready to come home, and Pastor Timothy was there, and he looked at me and he said, you can take pictures, and this is a picture of our son Heath. He was 32 when he passed. He said, Dale, these pictures you can put in your wallet or hang on your wall, and they will fade or they will crack, and they might fall apart. But if you take a picture and you put it in your heart, they live forever. So that's what I'm asking you. If you're the family of someone who's lost a loved one, come to us. We will help you. We want to put those pictures in your hearts to last forever. Again, thank you, and may God bless each of us as we strive to fight this battle together. Thank you.
Dale, thank you very much for sharing your story. Today we're also joined by Pastor Seibert Taylor. Pastor Taylor works with Ministers of Christ's Kingdom. Pastor Taylor is very involved in the work to save lives and prevent overdoses. So now I'd like to invite Pastor Taylor to the podium.
First of all, I'd like to say thank you to Sister Linda Gordon. There is a whole lot to be said about the drug episode that we're dealing with right now. As she stated, my name is Seibert F. Taylor, pastor of Mount Olive Missionary Baptist Church, secretary of MOC, which is Ministers of Christ's Kingdom. And when we help someone that have had an overdose, when we help someone who has came to us, and that's our main goal as Ministers of Christ's Kingdom, we not only want to help them to see that there is light on the other side of the tunnel, but we want them to realize that we're there whenever they need us. And when I say that about MOC is a group of men, as I said again, that are ministers that came together on one night when we were studying. And they're studying, and we wanted to ask the Lord, what would you have us to do? How can we serve the people better than what we're serving them on Sunday morning? And it all came to us, and we prayed about it for 4 weeks. This past October was 4 years that we have been in progress. And as sad as it is for me to say that our president, Brother Thomas Allen Sr., about a week ago, a little bit over a week ago, had came down with this COVID-19 and only lasted a short while and gone home to be with the Lord. He was the president of MOC. But I said that to say this: I receive phone calls quite frequently from individuals who want help. And as you know, and I know, that if you don't get to them right then when they call you, that it's too late. They change their mind. If it's not too late in them changing their mind, you may not read in the paper tomorrow about someone that have had an overdose and died. And this thing is real. And the hurting thing with me is a lot of us that are standing here today, we tell ourselves, well, I'm so glad that it's not in our families. But by morning, it could be in either one of our families that stand here or sit here this day. And I want you to know for the mayor and for those workers that work entirely to take care of those that have had overdose here in Lexington, we in this thing together. And the day that Lexington can see that we're in this thing together, I believe personally that we can make a difference here in Lexington. But what it's going to take is going to take us concerned together, loving those in spite of their circumstances. Don't look at someone else's son and say that's a shame. Don't look at someone else's daughter and say that that's a shame. Because I can say it again, you can go to the doctor today and he can prescribe you some pain pills. And before you know it, the next week, you strung out on substance abuse. But if we would ever come together, Lexington, if we would ever come together again like we ought to come together and lay down the barriers, as I preach Sunday, that so easily separates us, I believe personally that we can make a difference here in Lexington. But first of all, we must come together. I appreciate the work, Amy. I appreciate the work that the health department and I couldn't call the names of those that are working because there are a lot of folks that work behind the scene that nobody knows nothing about. So once again, as I shut this down, I could say a lot more, but I'm so proud to be able to have a couple of words and to tell you all that are here today and to let those know that are listening by television and that will be looking at the news and see what's going on. My phone is forever open. I don't care what time of night it is that you may need me. All you have to do is call. If you're wanting to go into a detox center, I personally can get you into the one that will fit you of whatever substance that you're on to see that you're in. And I thank God Almighty for those that He's allowed us to get into detox centers. Some of those have made it, some of those didn't make it. But my prayer is when they fall off, call me. I'll come back and get you. My prayer is I hope you never fall off again. But you know and I know for us that have dealt with these circumstances, you're going to fall off at least 3, 4, sometimes 5 times. Don't give up. As I said before, don't give up on him. Don't give up on her. They need us. The drug is the thing that's doing the talking. It's not them. The drug is the one that is devastating them. It's not them. Because as the brother said right before me, when they straight and they talking to you, they can do anything under the sun. But when that drug calls, it's so hard to walk away from it. May God bless each one of you. May He continue to watch over each one of us and give us that are here the strength that we need to be able to help those that have fallen prey, not only here in Lexington, but wherever they may be, to substance abuse. As I tell the church when I leave, I love you guys because of the work, you ladies, for the work that you do. Sister Gordon, we got to keep the work up. God bless each one of you and watch over you.
Thank you so much. As you can tell, Pastor Taylor is one of those warriors out on the street. Thank you for your work. My community response strategist, Andrea James, who couldn't be here today, and the city's substance use disorder intervention program coordinator, Amy Baker, wanted to make sure that on National Overdose Awareness Day this year, we did not miss the opportunity to publicly remember those who have died due to overdose. In honor of those who have died, the City of Lexington is hosting a Silver Ribbon campaign along Main Street, at our partner organizations, and in front of city buildings. We've placed silver ribbons, like this one, to recognize those who have lost someone to a drug overdose. We've distributed ribbons throughout the community for those who would like to show their own recognition. Parents who have lost a child are also displaying the ribbons. When you see a silver ribbon in Lexington, take a moment to remember those who have lost a loved one to the opioid epidemic. And following Pastor Taylor, I would also say, think about the young people you know and whether you need to say something in terms of helping. As we recognize those who have died of overdose, let's look forward to opportunities for recovery for those struggling with addiction right now. Like last year, Lexington will be participating in National Recovery Month in September. National Recovery Month is about informing all of us that with substance use disorder treatment and mental health treatment, people can live healthy, rewarding, productive lives. This year's theme is Join the Voices for Recovery, Celebrating Connections. One of our most important connections when addressing issues related to public health is our local health department. The health department is participating agency with Recovery Month this year, and if you watched their recent Facebook Live event about the growth of their harm reduction program, then you know that they understand the importance of connections. John Moses is team leader of the health department's Harm Reduction Services Project. John is going to come to the podium and tell us about what the health department has planned for September, National Recovery Month. John? Welcome.
Thank you, Mayor, Commissioners. International Overdose Awareness Day is a global event held on August 31st each year and aims to raise awareness of overdose and reduce the stigma of a drug-related death. It also acknowledges the grief felt by families and friends, remembering those who have died or had a permanent injury as the result of a drug overdose. International Overdose Awareness Day hopes to diminish that stigma associated with drug use. That includes all drugs, including alcohol. The goals of this day are to provide an opportunity for people to publicly mourn for loved ones, some for the first time, without feeling guilt or shame. To include the greatest number of people in Overdose Awareness Day events, as we've done today, and to encourage non-denominational involvement. To give community members information about the issue of fatal and non-fatal overdose, to send a strong message to current and former people who use drugs that they are valued, to stimulate discussion about overdose prevention and drug policy, and to provide information on the range of support services that exists in our local community. Overdoses can occur in people who have an addiction to substances, as well as those who do not, such as someone accidentally overdosing on prescription opioids after a surgery or injury, an elderly person consuming too much of a prescribed pain reliever, a teenager experimenting with illicit drug use for the first time, or a child ingesting pills that they've found in a medicine cabinet. When we talk about these issues, it's important to remember that language matters. The language that we use to discuss substance use disorder can perpetuate stigma. Stigma against those with a substance use disorder can impact people's willingness to seek help for fear that they will be judged or discriminated against. For instance, we say a person with a substance use disorder rather than addict or alcohol or drug abuser. The latter simply imply that the person is the problem rather than that the person has a problem. We also say that someone has a positive drug screen rather than a dirty drug screen. The first clearly states the results of a drug screen, and the second uses language with an extremely negative connotation in association with a person. As in many communities throughout the country, the national opioid epidemic poses a significant threat to public health and safety here in Lexington. Overdoses related to opioids are affecting more family members, neighbors, and friends than ever before. International Overdose Awareness Day spreads the message that the tragedy of overdose death is preventable. The Lexington-Fayette County Health Department, the city, and community partners are working hard to address this growing crisis through various efforts, including the distribution of naloxone, an overdose reversal medication, through the health department's harm reduction program. This partnership has allowed us to distribute more than 8,000 naloxone kits to participants in our syringe exchange, into the community, and into the jails. Every week, we hear people's stories of overdose, a friend or family member they've lost, and they tell us they've come to our program to stay alive until they're ready for treatment. COVID-19 has made this barrier even greater than we could ever imagine. More people have turned to drugs and alcohol. People who have been in recovery for a long time are now using drugs and alcohol again. But residents can help prevent overdose deaths by being aware of the signs and symptoms, knowing how to respond to an overdose. The city has taken great measures to make naloxone available for Lexington residents, the police department, fire department, and first responders, as well as provide opportunities for drug take-back days so residents can dispose of unused medicines and prescription drugs in a safe manner. The partnership that we have with the city to distribute naloxone has saved many lives. The Fayette County Health Department has seen over 6,000 individuals use our syringe exchange program over the last 5 years. We know that these numbers are increasing, and this partnership that we have with the city and treatment providers throughout the Commonwealth have made it possible for us to do our part, and we pledge to continue to do our part in stopping the spread of overdose here in Lexington. Thank you.
Thank you so much for all of you coming today. We will all be available, Amy, John, Pastor Taylor, and Dale, and I, for individual one-on-one questions. Thank you so much.